Hey, my name is Badass Benny. Welcome to my channel. And if you're an ACE, AMAC, or sex human trafficking survivor, you're in the right place. And it won't cost you a penny if you like and subscribe worldwide. Today we're going to talk about medical care, adult female patients, and the psychological reactions. And this will be one video, and then I'll do a second one on males, and then there'll be another one on the what exams would be, financial responsibility for examinations and treatment and testing. So this is going to be like a series of 3. And then we'll do cards. So this is the adult female patient, the psychological reactions in medical care. Rape and other forms of sexual assault may cause physical injury and or psychological trauma. Force, threats of force, weapons, threats of harm to a third person such as a child, psychological duress, and intimidations are methods employed by perpetrators. In situations involving threats or psychological coercion, physical injuries may not be sustained. Perpetrators may be strangers, acquaintances, or someone related to the victim. Victims of rape can sustain psychological trauma regardless of the relationship between offender and victim, the method of attack, the presence or absence of physical injuries, or the assault is attempted or completed. The stages of crisis reaction experienced by rape victims have been identified and described as the rape trauma syndrome by Burgess and Hallstrom in 1974, or post-traumatic stress disorder in the DSM-3 and 4 and 5. I think we have a DSM-5 today. Anxiety disorders and rape trauma syndrome has 2 phases: the immediate and acute phase and the long-term reorganization and assimilation phase. A. Immediate crises reactions. Emotional and behavioral stress reactions indicate of the acute phase include numbness, shock and disbelief, dazed or bewildered. That woman would look, like a deer in the headlight look. Diminished alertness, cognitive confusion, a flat affect, psychological distancing and preoccupation, something else is on their mind. Dulled sensory, affective, and memory functions. Feelings of terror, fearlessness, anxiety or hysteria, outward calm and collectiveness. Like, I've seen, people just numb. B. Subsequent emotional reactions, emotional behavioral stress reactions, which may last for several months or even years and cause significant disruption in the victim's life, include continuing fear, anxiety, sense of helplessness, persistent fear or depression, mood swings, denial, sleep disturbances, vivid dreams, recurrent nightmares, insomnia, and wakefulness, somatic symptoms. Appetite disturbances, so you'll have bulimia, anorexia, and other eating disorders. Poor concentration, preoccupation with the event, including flashbacks, self-blame, guilt and shame, sexual dysfunction, depressive symptoms, phobic reactions, withdrawal from peers and friends. So there's a lot of isolation. C. Supportive approach. Crisis intervention theory, which describes clusters of emotions proceeding through the phases of active crises, reintegration or crisis resolution, and normalization, provides a theoretical framework for understanding and responding to the patient. Psychological reactions may be experienced with varying degrees of intensity as the person progresses through each stage of emotional adjustment. Cultural differences, life stage issues, mental or physical disabilities, and previous victimization may intensify the physiological trauma experienced by the patient. Developmentally disabled, hearing impaired, and other handicapped individuals are especially at risk for sexual victimization and require particularly sensitive treatment. I remember being like 95% of disabled folks, especially developmentally disabled, special needs folks, is high in sexual assault. Examining practitioners must demonstrate non-judgmental, sympathetic approaches to assist with the reduction of the acute psychological trauma and its after effects. See the State of California Medical Protocol Information Guide for additional information on psychological and social cultural factors. So, what are you going to do to take care of yourself today?